If you're on Social Security or disability benefits, I have breaking news. I have your June 2025 Social Security payment schedule. Now, here's the thing, for disability benefits, some of you are not going to get a check in June. I'm going to explain why. And last month, both retirement and disability benefit payments came in later than usual due to the calendar. Is that what's going to happen in June as well? Well, I have the answer for you. And President Trump is promising to give seniors $4,000, a bonus that you've probably heard about all over the news. But the question is, are seniors really getting a $4,000 check, or is this one of those promises that gets everybody excited, but nothing comes to fruition? I've done the research, and the answer might surprise you. So let's dive in. I am Kwame Kwade. I am a personal finance expert and an entrepreneur for 15 years. I've been helping seniors get the retirement benefit they deserve. We cover topics from Social Security, Medicare, Medicaid, food stamps, and everything in between. So let's start with your June payment schedule. The first round of payments up to $5,108 are headed out soon. Find out who is eligible. And as I mentioned, there are some disability beneficiaries that are not going to get a check in June. I'm going to explain why that is. Now, obviously, the $5,108 is the maximum benefit you can get for Social Security benefits if you paid into the system, if you paid the maximum into the system, and if you waited until age 70. But if you are retiring this year and your full retirement age and you paid maximum into the Social Security system, the amount you can get is $4,018. That's the max. Now, for the average benefit, it's $1,925. That's when you put all the Social Security beneficiaries together and you find the average benefit. That is what people are getting currently. One thing that is changing this year is that the full retirement age is going up again by 2 months. It would increase to 66 years and 10 months. Now, let's talk about the schedule. You may already know this, but if you're on Social Security retirement benefit or disability benefits, SSDI, your payment schedule is based on your birth date. So if you're born between the 1st and the 10th of the month, you get your benefits on the second Wednesday of the month. If you're born between the 11th and the 20th, your benefits are paid on the third Wednesday of the month. And if you were born between the 21st and the 31st of the month, you get your Social Security and SSDI benefits on the fourth Wednesday of the month. So what does that translate into actual dates? I'll tell you in a second. But let's talk about SSI, Supplemental Security Income. Your payments are made on the first of the month unless the first is a weekend or a holiday. And there are a certain category of people who get their benefits on the third of the month. This includes those who live outside the United States, those who receive both Social Security and SSI benefits, if your state pays for your Medicare premium, and if you file for Social Security before 1997, your benefits are paid on the third of the month, unless the third is a weekend or a holiday. So let's talk about Social Security retirement and SSDI payment dates for June. The first payment is going to go out on June the 11th for those whose birthdays fall between the 1st and the 10th of the month. And then next will be June the 18th for those whose birthday falls between the 11th and the 20th. And then finally, on June the 25th, if your birthday falls between the 21st and the 31st. So this is probably a little bit later than usual. And for SSI, because June 1st, it's a weekend, you are going to be paid on Friday, May the 30th. And for those who live outside the United States or receive Social Security and SSI, or your state pays for your Medicare premium, or you started getting benefits before 1997, you are going to be paid on the 3rd, which is Tuesday, June the 3rd. Now, for SSI beneficiaries, you are not going to get a check in June because your June check is going to be sent to you in May, as I just mentioned. So expect your SSI benefits to hit your account on Friday, May the 30th, but you're not going to see any money in June at all until July. And so you have to budget accordingly. Now, if you don't get your benefit payments and it's been 3 business days you've waited 3 additional days and nothing happens, there may be a problem. You need to call the Social Security Administration at 1-800-772-1213. You may have an overpayment situation. And with overpayments, there's been a lot of news about that lately. Specifically, the Trump administration announced that they were going to start collecting 100% of benefits to pay back Social Security overpayments. So this includes retirement and disability benefits. If you end up in an overpayment situation, starting March the 27th, they will be taking all your check and using it to pay back what you owe. After a lot of pushback, including videos that we did, and ask you guys to go out there and call your senators, call your representatives, and let them know that this is going to crush a lot of low income, fixed income seniors. The Trump administration backed off, and now it's 50%. I mean, they're still going to take half of your check, but it's better than taking an entire check. And this is a change from when they used to only take 10% of your Social Security check if you got into an overpayment situation. So just make sure that you're staying on top of your earnings and reporting your earnings appropriately, whether you're on Social Security and claiming benefits before your full retirement age and continuing to work, or you are on disability benefits and working and required to report your income. Those are the two situations that really mostly get people into an overpayment situation. And then they found out months later that they owe the Social Security Administration money. And then now half of your check is going to be taken to pay that money back. If you have any questions or comments about this overpayment or your payment schedule, let me know in the comment section below. Now, let's talk about President Trump's promise to give seniors $4,000 check. Now, what I'm about to share with you is just the straight facts, no politics, because that's not what this channel is about. We want to bring you what is behind the headline. And in this case, there's a lot going on with this bonus check. So let's find out the details. So House Republicans have introduced a bill, which Trump is calling the One Big Beautiful Bill, that includes a $4,000 deduction that they are calling a bonus for adults over 65. The deduction is being promoted as a way to put more money in seniors' pockets without eliminating taxes on Social Security. So instead of going out and just eliminating taxes on Social Security as the president promised, what they're going to do is they're going to provide seniors with a $4,000 tax deduction. Now, there's a problem with this, and I'm going to share with you in a second. Not everybody is going to be, actually, most seniors are not going to be eligible. The deduction will apply to tax years 2025 to 2028, which is about the time Trump leaves office, fulfilling a campaign promise to deliver tax relief to seniors. The change is designed to help low and middle income seniors, especially those on fixed income. But here's the problem with this. With over 40% of older Americans relying on Social Security for most or all of their income, this is supposed to be helpful. But here's the thing. If you are not paying taxes or you don't even file taxes because you make less money, then this is not going to be helpful to you. So this $4,000 bonus that's supposed to go to seniors is actually going to help seniors in the upper end of the income schedule. The deduction is available to seniors over 85, whether they take standard deduction or itemized deductions. But a lot of seniors don't even file taxes because they don't make enough money. It begins to phase out for single filers with over $75,000 in income and married couples with joint income of $150,000. As a deduction, it reduces the amount of your income tax, which can lower your tax benefit by $500 a year for a typical retiree making around $50,000. So if you make about $50,000 a year, then you're going to get a $5,000 reduction in your taxes. If you make less than that and you don't file taxes, then this is meaningless to you. The deduction is designed to help low-income seniors, but as I mentioned, it's questionable whether that's going to happen. Social Security benefits can be taxed currently if your combined income is more than $25,000 for individuals and $32,000 for married couples. And up to 85% of your benefits may be taxable according to current rules. Now, eliminating taxes on Social Security, why wouldn't they just go ahead and do that? Well, it is because that takes money out of the Social Security Trust Fund, and that will make the situation of the Social Security Trust Fund worse, which means that seniors can expect more cuts to their benefits by 2033 when the Social Security Trust Fund runs out of money. So, getting rid of taxes on Social Security will cost $1 trillion over 10 years, while the $4,000 deduction, which does not apply to all seniors, will only cost $200 billion if it is made permanent. So you can see the difference, 1 trillion versus 200 billion, and that's why they're probably taking the less of the two. Now, what does this mean for low income seniors? Well, for seniors on Social Security, especially those on modest income, the $4,000 deduction would mean a few $100s in tax savings each year. While not life changing, it can help with rising costs, food, and medicine. Now, because the deduction is paid for out of general tax revenue, it won't worsen the Social Security Trust Fund issues, which I just talked about. And seniors who already pay no income tax, often the lowest income retirees, won't see this benefit. So, if you already don't pay any income tax because of your Social Security benefits and how much you get, then this $4,000 bonus that is all over the news does not mean much to you. The $4,000 is less costly, as I mentioned. The deduction is currently set to expire in 2028, and experts say that the deduction is a better way to help retirees than eliminating taxes on Social Security because of what I said earlier. Because if you eliminate taxes on Social Security, you're going to take $1 billion out of the Social Security Trust Fund over a 10-year period, and that could worsen the situation of the trust fund. So, what should you do now? Well, watch for updates. If this is going to be helpful to you, then stay tuned because the bill is now in front of the Senate, and I will bring you updates as they debate that bill and decide what to do about it. If you qualify, be sure to claim your tax deduction between 2025 and 2028. And if this does not affect you, I want to hear from you in the comment section below. What do you think should be done for seniors who are not going to be able to benefit from this $4,000 tax deduction that others are going to get because they file taxes because of how much income they have? What should be done for the rest of seniors who are not going to benefit from this? I want to hear from you in the comments section below. Now, if you're turning 65 and are looking into Medicare, or you're already on Medicare and you're unhappy with your current plan, I have great news for you. 90% of all seniors, you may not know this, are on the wrong Medicare plan. Why is that? Well, it's because there is so many things to consider when you're picking your Medicare benefit. And a lot of seniors probably are not informed enough to be able to know what to pick, what coverage, what doctor networks they need to be in, how to navigate around options, restrictions, costs, co-pays, deductibles. And so they end up picking the wrong plan, which could cost you money. The average couple spends over $300,000 on Medicare during retirement, and it could affect your health. Access to the right services when you need them is important. And so how do you get around this? Well, I have good news for you because we've partnered with an amazing organization called Chapter Medicare, and their whole mission is to help make Medicare simple, to help you understand your options, choose the right plan that's for you, and be able to use your Medicare to the maximum. Now, there's a personal story here. One of the co-founders of Chapter Medicare watched his parents struggle to navigate the process of choosing a Medicare plan and wound up paying premiums that were hundreds of dollars a month more than they ought to have been. And he realized that there's a better way to do this. And this is one of the reasons why he got into this business. And then another co-founder actually wrote one of the leading books on Medicare entitled It Is Not That Complicated. And he said that when he first became a Medicare advisor, he discovered that many Americans are getting misled into buying the wrong plan simply because no one took the time to explain their options to them. Actually, the Trump administration that just sued a whole bunch of Medicare advisory companies because they were misleading seniors into the wrong plans. Exactly what Ari Parker is saying here. And so Chapter is different because their whole mission is to help you. They are not there to advocate for the insurance company. They are there to advocate for you. And to prove that, they don't pay their agents, their licensed Medicare advisors, to push specific plans. They are there to figure out what plan is best for you based on your budget, your needs, and the coverage that you need to be in. So I want to encourage you today, call Chapter today. Even if you are not sure whether you are in the best plan, these guys can help you sort through that. Call them at 539-205-2147 or go to their website at askchapter.org/insider, and they can save you about $1,100 per year. And there are tons of 5-star reviews like this one right now that is in front of me. Is from Michelle S. She said, I can't praise Chapter and Shannon Davis enough. Shannon's knowledge and professionalism, and most importantly, compassion towards me in a very frantic situation was beyond words. Shannon treated me like family, a family member, and was able to keep me calm and with minimal tears shed. Well, her situation was very serious. After learning only 3 weeks ago that my biopsy results came back positive for cancer and my current Medicare insurance wasn't going to be accepted at the hospital, which is a very common situation when people move. To say I was devastated was putting it mildly, especially since I just moved 6 months ago and had to get a new health insurance at that time. Shannon went above and beyond to find a new insurance plan for me, even though the window, the enrollment period to change insurance had closed. I'm thrilled to report that as of April 2025, I was approved for a new insurance plan to begin May 1st. And with that, with the help of many, I am now scheduled for surgery on May 9th at the Memorial Sloan Kettering Cancer Center in New York City. Bottom line, don't hesitate to use Chapter. You will be happy you did. So don't take my word for it. Take Michelle S.'s word for it. The experience she had is the typical experience that people have with Chapter. And if you call, these are the guys you're going to be talking to, real agents that are going to help you figure out your options. They're going to show you when you call them a detailed information about doctors, specialists, prescription drugs, hospitals, all that is available to you, and then help you compare that plan to traditional Medicare so that you can make an informed decision. Highly rated by the Better Business Bureau, A+ rating, tons of 5-star reviews. And did I mention they can save you $1,100 a year on Medicare? So don't delay, call Chapter today. And finally, if you've been missing out on our newsletter, wait no longer. Our newsletter is rich with savings, discounts that are targeted at seniors to help you maximize your retirement benefits. And all you have to do is enter your email. So go to our YouTube channel. There is a link at the top. Click on that, enter your email address, and you'll be part of the insider group receiving our money saving discounts and also breaking news about news and updates, things that are happening in and out of Congress that could affect your Social Security, Medicare, Medicaid, food stamps. We've been hearing a lot about cuts to food stamps, Medicaid. If you want to stay on top of the news, sign up for our newsletter or go to benefitsinsider.co/subscribe. So that's all I have for you today. Until I see you tomorrow in our next video. Thanks for watching.